Hey everyone, I just wanted to hop on and give an update what I've learned this last week in school. So the primary focus of this week was on business and legal issues related to integrative medicine specifically. So just being really cognizant of my current licensure and how I approach treatment with patients. I'm not completely neglecting my primary training and knowledge, and that's like very foundational. And then the integrative Ayurveda comes in and it's just very complementary, a bit different approach on things. And then as far as when I make recommendations to a patient, um, which I've never done this before, but something to be mindful of is like, say, I'm recommending an herb for a patient. I'm by no means ever telling them that it's treating any type of medical condition. Um, so, like, one example would be I'm recommending that you take vitamin D. Vitamin D is a very fundamental vitamin. It's important for overall energy, mood, sleep, inflammation in the body. That's the primary purpose for taking that. So that would be like one example, or say like ashwagandha is an herb that helps with mood support um, and relaxation. So I'm not saying like this herb treats anxiety or this herb is for sleep or XYZ, for example. The next part in regards to the integrated medicine is like the business side of things. So I very much, in my current role, work within a larger healthcare organization. And so we use different codes for billing, and that's how, as a provider, I'm reimbursed. And so just being really mindful in my documentation because to get credit for the information I'm sharing with the patient, um, and it seems like my takeaway, the biggest thing is to do time-based billing. So amount of time spent with the patient, um, medical conditions addressed or patient concerns addressed, and then all of the things that I educated on or implemented on, and then billing from a time standpoint versus billing from these medical conditions and I addressed them and did labs and on the extent of my physical assessment on a patient. So there's kind of two avenues to billing. And then also from a business model standpoint, they were saying, like, as far as would you want to open a practice independently? Is the job that you're working at currently, is it does it give the potential opportunity for you to practice this integrative style of medicine? Because it's quite different in that it takes time that you're physically sitting with the patient, um, gathering an extensive history on the patient, focusing on their primary concerns, looking at their current medications and current medical conditions, and then making recommendations in regards to like lifestyle changes, which what I love about that is it's safe for everyone to do and none of it will affect medications. But then also considering the herb side of things and then ensuring that number one, it's safe for the patient to take with their other medications, that it's safe for them to take with their current medical conditions, and then informing the patient of potential risks or side effects that might occur with taking the herbs. And then also with herbs, just ensuring that they're safe to take together if a patient is on multiple things. So something like that, a visit like that takes a lot of time. It's not something quick and easy. Um, I would say it's easy, but it just takes time in being thorough with an exam, with reviewing the patient's current history and meds and supplements, and then just really connecting with the patient of their goals, and then kind of setting steps in place for them to implement to better help their vitality and overall quality of life. So, yeah, this week was business and legal issues. Kind of like dry subject matter for me. The most exciting part was in assessing the Ayurvedic pulse. We learned the fifth level, the fifth and last level of the pulse. That was really great too. Well, thanks for listening. I hope you have a wonderful week and I'll talk to you again soon. Bye.